As those of the previous patients is ongoing. The total number of close contacts that we have so far been monitoring stands at 745. Out of this number, 98 of them have been discharged after completing the 14-day follow-up period. We now have remaining 647 close contacts that our tracing teams are monitoring. 15 individuals are currently admitted at Bagathi Hospital waiting test results. Following our directive on the 22nd of March 2020 that all international travelers arriving through our entry points are undergoing mandatory quarantine in select hotels, government-designated facilities, and so on. I want to state that there has been challenges, particularly at the Jomo Kenyatta International Airport, as well as the designated hotels and government facilities, where we are taking the travelers for mandatory quarantine. This was bound to happen because of the huge numbers that are coming in, while at the same time, we do not want to leave anything to chance. However, we have streamlined the process, and this has been sorted out. In fact, we intend to introduce further measures to speed up the process and ease the inconvenience that we are clearly causing a lot of parents and a lot of passengers. I want to once again appeal to all travelers to bear with us as we continue to undertake this process. This intervention is aimed at stopping further introduction of virus in the country. And if you needed evidence that this is the case, just refer to what I've just said. On the better side of things, today we have received a donation of 25,000 testing kits for the coronavirus from the Chinese business magnate Jack Ma. On behalf of the government, I want to thank this gentleman for his generosity, as this will go a long way in helping us fight this disease. I also want to take this opportunity to thank those in Kenya who continue to support the government initiative, the business community, the parastatals and their boards, who continue to build water points, who continue to contribute towards resolving this issue. So we have both got international and national support. We shall continue to carry out mandatory testing for all contact cases, for all travelers who have arrived in Kenya, and generally speaking, we are going to increase and fast track our testing processes. We will not necessarily have to be very suspicious. We only have to have a contact, and we carry out testing. And this fast-track testing might be the solution. We are also looking at possibilities of acquisition of fast testing kits, and are in discussion, particularly with the Chinese government, on this issue. You will all appreciate that getting anything connected with coronavirus from anywhere in the world is now a challenge and difficult. But we are also exploring the possibilities of supplementing what we are importing with local production, particularly in masks, in uniforms, and other gear. As I conclude, I would like to urge all Kenyans to fully support the measures being undertaken by the government to deal with this deadly virus. It is the only sure way to cut transmission of the virus and mitigate it in our country. I would like to announce that tomorrow we will be announcing further measures as in view and in consideration of the developments so far. So today, I wanted to give the report. As far as the measures are concerned, there are ongoing meetings as we speak. I'm going to back into one. And tomorrow, we will be able to announce what further measures the government has decided to take to respond to the environment and the situation that is now presenting itself to us. Thank you very much, ladies and gentlemen.
Yes.
We are happy, at least that's a happy note for us, that most or in fact, except for 2 cases, except for 2 elderly gentlemen who are not completely sick. I mean, they are not in ventilators or anything, but they have shown signs of being unwell. The one in Kilifi, we actually flew a ventilator, for them yesterday, and from what the reports I got this morning is that the Frenchman is responding well. But all the other people that have tested positive are okay. We think we might have some good news, but we don't want to start announcing things and then start going backwards. But keep your fingers crossed. I think soon we could actually be happy about what we are receiving. But for now, I want to leave it there, and I say that somebody's prayers are being answered.
Just question moja, swali moja tu.
Well, as I said yesterday or the day before, I said that every measure we take, we'll have a countermeasure in terms of government effectiveness. Anything else?
Neto?
Yes, Steve. We have said before that the kids were not sent home on holiday. The kids were sent home for protection. And let me just say this, for clarity. Let me just say this. We are suffering from cases of indiscipline. And Kenyans are exhibiting a very indisciplined behavior. And this is going to cost us. When we tell people, keep your kids safe, we don't mean you keep your kids safe by bringing somebody in who, for all you know, is coronavirus positive. We are telling you to keep your kids home with you, at home, not exposing them to the disease. That's why they are home in the first place. So, Steve, you need to tell them. You are the one in the media. Tell them. It's a grievous mistake for us to give you your child because we don't want the child exposed, and then you go exposing the child at home. And then afterwards, you call us and say, Serikali's idea. It doesn't work. This is one time when you idea, the government won't idea, because the government cannot help each and every home and every child. We want responsibility among citizens. On the high-risk areas, we have identified, indeed, certain counties that we feel, and indeed the 4 counties that I have counted: Nairobi, Mombasa, Kwale, Kilifi. We have always felt that these counties have got extra exposure, and we have also taken measures in those counties to create extra capacity and extra response mechanism, than would be in other counties. But let me just say this. It is important for us to keep recognizing that if we tell people to do things and they don't do them, if we tell you that a matatu should have 8 people, and then you do it when you are being watched by the police, and then when you leave the police, you go and start doing it, you go back to normal. It is unfathomable. It is difficult to understand what you are trying to do. Are you trying to kill yourself, or are you trying to kill the people that you are carrying in your matatu? That's a question one needs to answer. The other point that I would like to make, and this is connected with our the travelers who we have kept in quarantine, is to say that the hotels that these people are staying in must not take advantage of them. It is immoral, and I repeated it the other day, it is immoral to take advantage of persons who have no choice. If anything, what they should be telling us is that this amount is just enough to cover our costs. That's what they should be telling us. They should be sacrificing and saying to us, let's pay only this much, which covers the food and generally the operational costs. But to add on huge profits on the backbone of suffering Kenyans is really, really unacceptable. So I'm appealing again to those handling the travelers, to those handling those in quarantine, to exhibit patriotism and generosity and consideration so that we don't add insult onto injury.
Just one. Yes.
Horizontal level where it's now becoming local infection. Are we at this particular time, and how difficult and prepared are we in terms of anticipating that particular infection from local to another, or from an individual to a community? That is just one. And then number two, of course, we have law enforcers who, are some of the people on the front line trying just to maintain law and order in terms of social distancing and to make sure that some of the regulations put by the ministry is effective. But how safe are they? And what kind of sanitizers are using? Are they well equipped in terms of observing medical equipment to that?
Thank you very much. Let me start with the last one, law and order. First and foremost, we have been carrying out training of the police, particularly the traffic police. At the appropriate time, they would obviously know what to do because they have had this training. But as the situation unfolds, then we might require them to do a little bit more than they currently are doing. And as for local to local, at the moment, we are still talking import and contact to import, and therefore we obviously, and the situation is unfolding, it's difficult to tell right now. Having not carried out all the tests that we need to carry, it's very difficult for me to confirm with you what exactly that situation is. But at the moment, we haven't really tracked to that level. So I want to once again reiterate our thanks to the medical fraternity. The equipment that we received today, in addition to the testing kits, will go a long way to ensuring safety of our health workers, and I want to emphasize that's a key. It's a key consideration for us. And as you know, we also have people, not just the ones you see. We have people in labs who are working very hard, and this testing I'm talking about, they are the ones who are carrying out. And I don't know, ladies and gentlemen, whether you know a gentleman called Mamo Umoro, the head of the national. Where is Mamo? Oh, he's here. This gentleman you are seeing here, the head of the national laboratory, he is the one who is carrying out a lot of tests. And you're telling me that we are now improving to how many?
We have the capacity now to test all the labs, 300 samples per day within 24 hours.
Within 24 hours now, they have uplifted capacity to testing 300. So what you are saying is that even to test the ones that we are seeing is not that difficult. We obviously want to improve that so that if we get the new testing kits, then you'll be able to test in 45 minutes, which is going to really fast track the testing. However, we are also being careful. We don't want fake testing kits being dumped here, and then we are testing people and saying they are positive, they are negative or positive, and we have no idea. As you know, this has been done before. Stuff has been dumped onto Kenya. And anybody wanting to sell things here has two questions to answer. Number one, is it being used in your own country? Because if it is not being used in their own country, why would they be bringing it here? Why would we be testing our people? We are not exactly guinea pigs. The second question, is it approved in your own country, and is it approved? Does it have a WHO status? If it doesn't have, if the answer to any of those questions is no, then we are not interested. If the answer to both questions is yes, we are definitely interested. And that's when we would fast track it, airlift it, if we can get them, because that is the other challenge. The other lab that we are also using is KEMRI, as you are aware, which has established many centers. And also with us here from KEMRI is Rutomia Joyo. Is he here? Rutomia, where are you? Oh, you're also on this side. That gentleman is also working very hard at KEMRI to ensure that what we send to them is tested immediately. And I realize that we had a couple of issues when we started, but Rutomia, maybe you can tell them you are capable of doing this now.
Yeah, thank you, sir. Currently, the KEMRI laboratories have a capacity of testing 350 samples.
Say from here. Say from here.
Thank you. Currently, the Kenya Medical Research Laboratory has the capacity to test for 360 samples in a given day, that is 24 hours. We have the machines, we have the personnel who are well trained, and we have the kits, so the country should rest assured that any samples that comes to us, I think, will be tested, and the results will be relayed to the public within the shortest time period. Thank you.
Thank you very much. I'll ask the Director General, Acting Director General of Health, if he has got something to add, but for me, thank you all very much. Are you here?
Thank you, Waziri. Just to add on to that, that we are also working very hard with Moi Teaching and Referral Hospital to be able to establish another testing facility in the North Rift that can be able to serve the North Rift countries. Therefore, as we go ahead, we are going to be able to deploy testing to the county level so that we can be able to have a shorter turnaround time and therefore quicker decision making, and to reassure Kenyans about their COVID-19 status. And finally, just to appreciate once again, the hard work done by the healthcare professionals from the Port Health, the people in the lab, the clinicians, the doctors, the laboratory guys who are doing a wonderful job working under very difficult circumstances to be able to deliver these results to allay the fear and anxiety of Kenyans. And of course, the support that Kenyans from all walks of life have extended to us during this difficult time. I know it is a difficult period for the nation, but together we shall overcome if we hold our hands together. Thank you.
Yeah.
Ni kutoka kaunti, na kuna kaunti zilizoathirika zaidi ni kaunti ya Nairobi.
Coronavirus is a large family of viruses called coronaviruses, and these have been there for long, and they cause diseases in both human beings and animals. In human beings, several coronaviruses cause several illnesses, with some mild like common colds and other severe illnesses. The most recently discovered coronavirus is the one we are calling COVID-19, and it is now responsible for now what we are calling coronavirus disease. The symptoms generally are fever, tiredness, and dry cough, and these are usually mild. But some patients may develop aches, pains, nasal congestion, runny nose, sore throat, and some diarrhea. In 80% of clients, they usually have mild disease, and this might resolve on its own even without serious medical intervention. But 1 out of 6 patients might develop serious illness, which may cause difficulty in breathing, which now calls for medical intervention. Generally, this problem is more severe in older people or people who have chronic illnesses like hypertension, diabetes, heart problems. And from the statistics we have, is about 2% of the people right now who have been affected by this coronavirus disease have died. So you can see from the statistics is that it's only a small percentage. It's not as virulent as a disease like Ebola. The virus spreads from person to person, and it is mainly if a person near you is sneezing on objects and then you hold the object and then you touch your eyes or your nose or your mouth. It also can be spread if you inhale droplets which have been which a person who is already sick has exhaled or has sneezed into the environment. And the incubation period in this matter is the period between when you get the infection and when we start seeing clear signs and symptoms. Generally, the incubation period as of now is known to be between 1 and 14 days. I should also make it clear that people should have good respiratory hygiene. So for example, if you are coughing or sneezing in public, you should sneeze into your folded arm like this, or sneeze into a serviette or a handkerchief so that you don't spread the same. And generally, if you have fever, difficulties in breathing, you should seek medical advice. So should everyone have a mask? No. Masks generally are recommended for clients or patients who already have the problem, or medical personnel who are handling this kind of patients, or a person who is assisting at home a patient who already have signs and symptoms. The county government of Nakuru is educating the public on coronavirus so that they know what is it. And 2, we are giving the public information on how to prevent themselves from getting this disease in case it ever comes around. And then we've put in together a surveillance team and a response team in case we have any reports of any presence of such an incident anywhere. And we have also procured PPEs, personal protection equipment, and they are ready for use by our health personnel in case we get a client. We have also trained about 200 health personnel, that is at the Provincial General Hospital in Nakuru, at Naivasha, and Gilgil Hospital. So we have a complement of 200 personnel of all cadres. And finally, we have identified an isolated treatment facility in case there is need for such.